All right. Well, everybody, thank you so much for attending today's session on Ask an Ambassador session today, sponsored by the Association for Schools and Programs and Public Health. Today, we are so excited to have many of our ambassadors here today, past and present, that will be sharing their experiences about why they chose the career of public health. They'll talk about the application process, how they decided to choose a concentration in public health. You'll find that public health has a lot of different ways that you can get involved, whether you are interested in behavioral science, environmental health, etc. You'll learn about their path in choosing their concentration in their career, as well as understanding a little bit more about the field and how you can get involved through internships, graduate assistantships, and even full-time positions. So we're excited to have this conversation today, and we'll get to meet our This is Public Health ambassadors. You're probably wondering what This is Public Health is. This is Public Health is an initiative started by ASPPH to raise awareness about the field of public health. We have ambassadors across the nation that are in master's programs as well as doctoral programs within a variety of different schools and programs within ASPPH that kind of serve as our ambassadors just to talk about what public health is and why you should be involved. And so with that said, we will go ahead and get started. And I should introduce myself to you as well. My name is Joanne Williams. I am the Associate Director for Student Engagement at the Rollins School of Public Health located at Emory University in Atlanta, Georgia. And I'm excited to be here with you today to help lead this conversation. I also was a This is Public Health ambassador in 2017 in the very first cohort. And so I'm excited to continue in this role, learning about the intersection between public health and student affairs. And last but not least, I also am still involved in ASPPH as the co-elect or as the co-chair-elect for the Student Services Assembly. And with that said, let's go ahead and meet our panelists. So I'm going to invite each of our panelists to introduce themselves and provide a brief introduction to where you go to school or where you've gone to school, your concentration, as well as what is your public health passion. So we will go ahead and start with Noor.
Hi all, my name is Noor Ali. I am a current MPH candidate in the Global Health track at Vanderbilt University School of Medicine, and I am an ambassador for this year, for 2021-2022. So I would say that my public health passion is to assist communities in finding and unlocking their agency and power through health. I'm really excited to be here and I can't wait for the questions. Thank you.
Thanks, Noor. And next we have Dan.
Hi, everyone. My name is Dan Popkin. I'm a second year at the Rollins School of Public Health at Emory University in Atlanta, Georgia. I am a second year in the epidemiology concentration with a certificate in infectious disease epidemiology. My interests most align with zoonotic as well as healthcare acquired infections, or really just anything that requires an outbreak investigation.
Thank you, Dan. And next we have Kaula.
Hi everyone, my name is Khawla Nasruddin. I'm from Lebanon. I did my undergrad at Berea College in Kentucky in psychology and then studied public health at the American University of Beirut Faculty of Health Sciences, and I concentrated in health promotion and community health. But throughout my work, I've been focusing as well on health governance, and my main areas of focus through research, activism, and interventions has been on community health-based promotion and health governance and health of people on the move. Lovely to be with you all today.
Thank you. And next we have Jen.
Hi everyone, my name is Jen Rue. I graduated from the Colorado School of Public Health in May of 21, and I concentrated in global health and health disparities there. And I was also an ambassador in 2020. And my main reason for going into public health was to concentrate on health equity. And I'm grateful to say now that I'm in an organization that really centers that around its work. And yeah, I'm really excited to be here. Thank you.
Thank you, Jen. And last we have Larry.
Hi, everyone. My name is Larry Warner. I'm a graduate of Brown University MPH program there, and currently a BRPH candidate at Johns Hopkins Bloomberg School of Public Health. I'm in the 2021-2022 TIPH ambassador cohort, and I'm interested in building healthy and thriving and equitable communities. I'm happy to be part of today's panel.
Thank you, Larry, and thanks to the wonderful introductions, everybody. Let's go ahead and get started with our conversation. We do have questions prepared for today's session, and so the first question that I want to ask is just think back, to the application process and kind of what inspired you to choose this field. Why did you choose the field of public health? And let's go ahead and start with Gaula.
Yes, so basically for me, between my undergraduate degree and graduate degree, I took a year and a half in between to practice more health governance. So my focus was on mental health, but I took some courses in service learning that really helped me be fascinated by the art of health interventions and working on upstream solutions and upstream healthy environments surrounding mental health. To begin with. So I was really interested in the intersection between social justice, mental health or social behavioral sciences, and community health in general. But when I look at specific times that really inspired me to study public health, so when I was younger, my mom, she's a midwife, and I would go join her. She would go to many rural communities and informal settlements in Lebanon, and she would just have those health circles, sitting in circles, and she's an advocate for reproductive health and rights. And she would just create this safe environment for individuals to ask questions, to discuss. And at that time, she really didn't label it as public health, but I was witnessing this and I was fascinated by this grace within the community and how they discuss health. So I think this is like one of the earliest inspirations that helped me continue to be interested in health and community health specifically.
Thank you so much for sharing. And I love that, just based off of your response, I'm hearing things about community, social justice, and service learning. And, that is the essence of what public health is. I'd love to hear from others. Let's go to Noor. Noor, why did you choose the field of public health?
Yeah, so I know that the question is, why did I choose? But I really think that public health chose me. So when I was finished with my undergrad, I really, I had always wanted to be a physician. And I really, felt that I was strong in the science of medicine, but I didn't think that I was very strong in the art of medicine. And so I took time off and I did a lot of research in global health. I did some work in Honduras, I did some work in Pakistan, and I really found that the art of medicine is public health. And so when I had to leave Pakistan early because of COVID, and one of my mentors from my previous institution told me, the work that you've been doing is public health. And I was like, no, I just need to be a doctor. I need to get this over with. I don't need any additional degrees. And they were like, no, what you're doing is public health. And so I really sat down and understood what public health was. And I realized that to me, public health is the art of medicine. And, what I really want to do is combine the science of medicine and the art of medicine, which is public health, and, really be that physician that I want to be in. So public health to me is both the science and art of medicine. And it chose me, it opened up to me when I was working in communities. And it really, really helped me, find what my passion is in life. But it was there are no words as to why I chose public health. It's so much of a feeling more than anything else. That's probably very abstract, but it makes sense to me.
And how would you describe that feeling, like the feeling of like being involved in public health, Noor?
Yeah, it honestly makes me feel whole. Like I recognize that there are communities that are outside of, my circle or in my view or in my school that need help. And it's so much more about, it allows you to recognize that it's not just you and you need an entire cohort, a coalition. You have to empower to succeed. And I love that feeling.
Awesome. Thank you so much for sharing, Noor. And yeah, I totally agree with you that public health is more of like, it's service oriented, but there's a lot of humility that goes behind it, especially as we learn from other communities at a local, national, global level. And what about you, Larry? Why did you choose the field of public health?
Sure. So I would almost say that public health chose me as well. I chuckled when North started a response with that because I was thinking the same thing. My journey is kind of it's been a journey in multiple parts. As an undergrad, I took a couple of courses in anthropology, one being an intro to anthropology, and then the second being medical anthropology, that really changed my thinking about what informs our health and how culture and society, how we perceive it and how it exists, maybe two different things. And so that was sort of my initial formative experience with public health. And then as I entered the workforce and worked in community education, and then eventually became a first responder. I worked as a firefighter and EMT in Providence, Rhode Island for 15 years and had a unique vantage point on community during a number of different experiences, and obviously experiencing people in their time of greatest need, whether in a medical emergency or man-made or personal or natural disaster. So how the disproportionate burden of health and disasters impacted different communities. And so that was my motivation to go back to school and pursue a Master of Public Health, where I focused primarily on health literacy and access to healthcare, utilization of healthcare services there. And then after a couple of years completing my PhD, transitioned into health philanthropy, and now work at United Way of Rhode Island, where I lead a team that's working on policy and grant making and direct community services as well. And en route to where I am now, began the Doctor of Public Health program at Johns Hopkins, where I really was looking for an experience that was both increasing my knowledge base and my subject matter expertise, but also gave me additional professional skills to be a contributor to this work and to engage the community. And so I really am interested in engaging stakeholders to advance equity in community and see public health as both the healthcare delivery system that Nora has described, but also all of the other components of society that contribute to safety and equitable health outcomes.
Thanks, Larry. And I love what you were saying in terms of like culture and society and how it impacts public health and how it impacts our work. But I think what really stands out in your response is that public health is also collaborative, right? It involves working with other partners, whereas, medicine has more of that individual based work, which is also important. Public health is about affecting the masses. So I love hearing, about your inspiration of why to join the field of public health. Now let's talk about the application process for a little bit, just kind of going back in time, way back to when you were applying. If you could give yourself one piece of advice as you were applying to public health school, what would it be? And let's start with Jen.
Yeah, so as we all know, applying to grad school and public health there's so many different elements that go into it, and it can be stressful yet exciting. And it can be easy to lose sight of, the different elements within a program. And for me, what helped was when I was applying, I got into contact with some of the admissions staff and just, got on the phone with them, ask them different things about the program. But going back, I would advise myself to maybe connect with some students and professors, get a better sense of, the community of the program, different classes that I should take and different opportunities for, graduate research positions and such. But yeah, through my program, I found that those connections really steered me to different opportunities. So I wish I started sooner.
Awesome. And when do you think you would recommend students, kind of start with the application process? Like how far in advance do you wish that you started?
So I started like summer and then applied early in the year. And for me, I think I was just trying to get a sense of, which programs did I want? What concentration did I want? And I think had I done it during that process, it might have helped me, pick out a little bit more of my interests and different places that I could go and, what alumni in my field are doing now. And if I'd like to kind of be there down the line. So I think as early as possible, but everyone's on their own timeline. So better late than never.
That's right. Absolutely. Thanks so much, Jen. And Dan, what about you? If you could go back to the application process when you were applying, what would you tell yourself?
Yeah, thanks. I would definitely challenge myself to find a program that allowed me to explore public health at the breadth as well as the depth that I was looking for. I think a lot of programs are really strong in certain elements, but I knew personally for myself, I was kind of all over the map coming into the field of public health. I thought I wanted to do infectious diseases. I thought I wanted to do emergency management. I couldn't necessarily see how they aligned at the time. Obviously now, with more knowledge, things have changed, but really understanding and finding a program that was not only going to allow me to explore my interests within public health, but also encourage that. And one thing that I really love about my program is that it's really flexible in terms of electives, not only within the School of Public Health, but also within the greater university, whether that be the nursing school, the business school, or other departments. So just allowing for that flexibility to me was really important and seemed to encourage me to find my place within the field of public health.
Thanks so much, Dan. And I think that's a great point that both you and Jen kind of brought up, is that, it starts in the application process, but the journey really continues throughout your school or the program that you choose based off of what you think is the right fit for you. And so, part of being in school is not necessarily knowing like, this is what I have to do, but really like, engaging in the journey of all these different options that will eventually lead into your full-time professional career. It's about kind of tailoring what your goals are for yourself and what you want to accomplish in public health. So that's great. So Jen and Dan, you kind of talked about, choosing a concentration and just kind of narrowing things down. And so let's talk concentrations for a second. What area or concentration of public health did you decide to go into and why? So let's go ahead and start with Noor.
Yeah, so my concentration right now is global health, and it seems like it's a lot, and it is a lot because it can be really anything you want. So the reason that I chose global health is, I had done work in global health. It was something that I was familiar with, but also it's because I am really, I'm from Eastern Kentucky. And so I grew up in a very rural setting, in a rural health setting. And I was always inquisitive as to why, why don't I get the same opportunities in healthcare that, people who are living in bigger cities do? And why is rural health different than city health or urban health? And so I recognize that, there are social determinants of health, there are physical, biological determinants of health as well. And so I recognize that rural health is so similar to global health. When I was doing my work in Pakistan, I recognized that the same, problem of diabetes that people in Pakistan had, my fellow Eastern Kentuckians also had. And I wanted to understand why that was. And so, kind of like what Dan said, I've had a really good opportunity of taking these elective classes and taking classes that, though I am in global health, I can focus in on certain communities or certain diseases and kind of figure out and find my passion. So I chose global health. Yes, it's a broad field, but it also can be very, you can narrow it down as you learn more about yourself, your program. And once you're really in a program, I think that's how you really understand.
Thanks so much, Nora. That's excellent insight. And Dan, what about you? How did you choose your concentration?
Yeah, I think for me, I had taken a few classes in undergrad, and I would encourage anyone that has the opportunity to go ahead and do so. But with that being said, also, if your school doesn't have a public health undergrad or classes like that, don't worry, because it does not mean you're behind. But in terms of why I chose epidemiology, I thought that it was a really broad field. And also with COVID, you saw all the numbers and everything coming out. But there's kind of this misunderstanding, and there's this gap between the knowledge and the data, and really understanding and communicating to the community what these numbers mean and how they impact everyone's life on a day-to-day basis. So with regard to that, I thought that I could really help kind of bridge that gap for people, and I was excited about that opportunity.
Thanks so much, Dan. And Larry, what about you? What area or why did you choose your concentration?
I'm concentrating in health equity and social justice, and I chose that concentration because at the time I had been engaged in community-based conversations, both in the context of a commission for health advocacy and equity that our state has, that I was serving on, and in my in my role as a grant maker that I was really looking for additional knowledge and skills to help me be more effective in my work and engaging with the community in a partnership approach to advancing public health. And so health equity and social justice was the right concentration at the time, and it was before a lot of our community stakeholders became awakened to the need to advance, to talk about racial equity and justice through George Floyd's murder and other happenings in over the past couple of years. So I started on this journey in 2017 and had not had the foresight of what was about to happen over the following years. And so fortunately, it was a timely journey to begin then, and I'm hoping to be done soon. But health equity and social justice is really where I'm hoping to impact the community through public health.
Awesome. Thank you so much, Larry, and thanks for sharing. So we're looking at where a lot of you are currently are, or maybe as a recent grad, where you've been in terms of, you know, your concentration, how you narrow down things based off of your passions and your experiences. So let's kind of look ahead into the future. What are you all hoping to address in your public health career? Let's go ahead and start with Noor on this one.
Sure. So what I'm kind of hoping to do with public health is I want to take what I've learned in my degree in obtaining public health, both in a school setting, in a community setting, and bring that into wherever I choose to go to medical school and help my classmates and help myself understand that, you know, medicine is not just, you know, biology, chemistry. There's a completely more factor to it. And I really want people to recognize the power that public health has. I think that a lot of times people are like, oh yeah, public health, it's underfunded, it's not important, that's why it's underfunded. But public health is literally what makes our communities move and thrive. And I want people to really understand that, both from a physician perspective and from a community perspective.
Great, thank you so much. And can you tell us a little bit more, Noor, about you mentioned briefly that you're interested in pursuing a tertiary degree and you know, becoming a doctor. So how do you think that pursuing a master's degree or master's of science degree in public health is going to help influence that path?
Oh, it's affected it 100%. Like, I have become a stronger person, soon to be physician, because of this degree. You know, I have recognized that there is so much power in working in a community. And I think that a lot of times, you know, people in medicine get a really bad rep that they're very selfish. They want to do things on their own. They're not very community centered. But obtaining this public health degree has 100% solidified the importance of engaging with communities. And when I say engaging, I don't mean, you know, going into these communities, whether it's a global, rural, local, whatever, and, you know, giving them an agenda. It's listening to them and getting the agenda from them. It's all about human-centered design. And that's what, you know, what I see as the future of medicine to be. And I really hope that, you know, the public health knowledge that I've gained, you know, does that. It creates the future of medicine. It would be an honor to be a part of that. So yeah.
Great, awesome. Thank you so much, Noor. And Kaula, what about you? What are you hoping to address in your public health career?
So, I mean, for me, when I started my master's, you would tell me that in the past 2.5 years, 2 years, since the beginning of the pandemic, I would only have like 3 hours of in-person work while I've concentrated in community health and health promotion. I would be really surprised. So there's a lot of changes. I think more so that the key is to continue with education, whether that is formal education or informal, just to continue to be informed. I hope to be able to stay informed, stay active with the community through service volunteering as well. But I really hope to be able to create bridges between academia, policymaking, civil society, through participatory change making and participatory governance in health. And again, I think as a public health, when you study public health, the beauty of it is that you can be really a connector. You cannot just address mental health without understanding environmental health. You cannot address the health of people on the move or people who are migrating without understanding health policies, migration policies. So kind of, I really hope to be able to continue to stay up to date, gain new skills, and really listen and unlearn as well with time. You know that in my master's, I got to unlearn a lot of practices as well, in terms of health communication and such. So I think it's not always extremely clear what it would look like, but I hope to continue to maintain those traits as I move forward in my career.
Definitely. And I love that you're kind of talking about, your career path in terms of like, there's a little bit of flexibility in like what you want to do. And that's the beauty of public health, is that not only is it, an established field, but it's a field that's always changing, especially, in what we've experienced in the last 2.5 years, the coronavirus pandemic, and how we've had to change the way we've had to communicate health messages.
Mm-hmm.
We approach different concentrations and areas in public health. And so it's an exciting field for all of us just to be in, because we're part of this change, and we're creating these new methods and practices that we hope future generations will use. So that's great. Thank you so much. So thinking about, the careers that you have now, right, or the careers that you're setting off to achieve, if you haven't graduated from your program yet, what do you think are the most important skills that you've learned, or maybe knowledge that you've kind of taken away from your respective programs that you found most useful? So think about courses, think about like extracurricular activities, things in your experiences and lessons that you just taken that you plan on applying in your career. Let's go ahead and start with Jen.
Yeah, so my undergrad was not in public health, and I always say that I was very late to the public health realm of things. And then I got into public health and I was like, you know what, this is everything, it's everywhere. Even if you don't realize, some things that you do might be considered public health. But yeah, coming into the program, I really sunk my teeth into, the subject matter and the expertise, and it gave a huge just background and opened a world to public health. But I think one of the biggest lessons I learned that I'll apply to everything that I do is this notion of intersectionality between, everything that we do, and having to apply that intersectional lens. And prior to coming to the program, I think I really approached everything in silos and compartmentalized different aspects of, knowledge and education. But coming into public health, I think that having this intersectional lens is crucial to, one, the work that we do, and just, seeing people and communities as a whole for all the different aspects that impact them. So yeah.
That's great, Jen. And for our participants today, would you be willing to offer a definition of intersectionality?
Yeah,
like to the best of your ability, and folks, panelists on the call can jump into in terms of how you've experienced intersectionality in your work.
Yeah, so I'll try to go off the bat, but I welcome everyone to kind of add to this. When I think of intersectionality, you take, one problem and say there's this one element of that problem. You need to be considering all the different influences that maybe go into it, the different aspects of a person. So you're not just looking at, one symptom, you're looking at the causes of that, you're looking at the environment that it's in, you're looking at how those all, interrelate and communicate with each other. So very broad, but if the other panelists have, something to add to that, I welcome it, because it's important.
I can add. I think that intersectionality is the notion that an issue or an identity is not monolithic in nature, and that, for example, I've most often heard intersectionality used when in the context of identity. And so I'm not just Larry. I'm Larry, who's a Black, straight, male, cisgendered. And so all of those identities contribute to my experience and the outcomes that I'm experiencing as well. And the problems that we're trying to address and solve for in public health are not just public health issues. And so, or don't require, let me rephrase that, they require more than just public health experts and professionals working on these issues. And to achieve goals and advances in public health, we really need to be talking to and engaging with partners outside of the traditional public health world. And so that means, public planning and public safety, in addition to our healthcare delivery system and education stakeholders. And so it really takes an intersectional approach, looking at the root causes of the issues that we're trying to address, and collaborate with multiple partners outside of the traditional folks that we turn to when we think about public health. So that's how I think about intersectionality.
That's great, Larry. And I love, Larry, that you've mentioned, and Jen, both of you have mentioned intersectionality at a variety of different levels. I think Jen really addressed it at the systems level and really kind of tying in. And Larry too, both of you really introduced intersectionality at the systems level. We're thinking about how policy, environment, culture, society influences the overall health of a population. And Larry, I think you really touched on intersectionality in terms of identity, right? In terms of how we as individuals and how we identify impact how we access services and why, and what are some of the barriers that individuals might experience because of some of these, not only identity, but like socio-contextual determinants of health, and looking at things at the full picture. So yeah, thank you so much for the discussion. I know that was a hard one to just kind of ask you outside of the blue, but I appreciate that. Larry, just to kind of expand a little bit on your response, outside of intersectionality and kind of exploring that within your program, what are some other skills or experiences that you learned throughout your program that you can find most successful in your career?
So I really appreciated all the coursework that I've done, which has been wide ranging from some of the identifying and taking a deeper dive on some of the core concepts around health equity and social justice, to a lot of the skills that are essential for public health leadership, whether it's within an initiative or in an organization. And so organizational leadership was one of the first courses that I took as part of my program. Learning not only how to navigate personalities and systems, but how to connect with internal and external stakeholders. Public health communications was another area of importance that helped me grow a lot for forums like this, as well as engaging key stakeholders one-on-one. And then I think that power mapping was a key concept and area, which was relatively new to me, but understanding how to move policy, and which you talked about, Joanne, sometimes the direct path is not the one that is most effective, but understanding who lands where within a spectrum of an issue, and who you need to move in order to a certain point in that spectrum in order to get a successful outcome. And so those were some of the key areas that I think have been helpful in my public health journey and contributing to some of the successes our community's been able to see.
Awesome. Thanks, Larry. So well said. Amazing. And so Larry was talking a little bit more about his courses, but within schools and programs in public health, there might be other opportunities outside of your academic coursework that could help determine like what you want to do in your public health career. This could include graduate assistantships, internships, and even student organizations and extracurricular activities. So I do want to ask this group, throughout your program, what are some activities outside of the classroom that you've participated in that's really enhanced your experiences and led to your success in the field? So I'll go ahead and start with Gaula for this one.
Yes, so this is really what I think. I always tell them that basically I learned public health from the streets of Beirut. So for me, it happened that when I started my MPH, it was the revolution in Lebanon. There was the uprising because of, it was the beginning of the economic crisis. There was a lot going on. And for me, I was taking my backpack after class, walking down the street all the way down to downtown where they were meeting. I would sit with environmental health circles. I would march with cancer patients that were demanding affordable treatment and anything. I was just really very immersed in the community. And that was for me really what taught me a lot about public health. But also I was always, my coping mechanism with the pandemic was to try, because I was suddenly remote after that. So I was trying to do a lot of online volunteering. I volunteered with the United Nations volunteers in Lebanon to map community-based initiatives in response to COVID. I was volunteering with faculty to do research. I was part of the WHO TDR scholarship focusing on diseases of poverty. So I was also working, doing research as part of my training. So I would reach out to faculty to know what kind of research they're doing, if they need any support, whether it's coding data or writing papers or just going and collecting data on the field. So I think you really learn a lot beyond the syllabi. And I know it's difficult to manage time and such. For me, it was convenient that everything was online. It gave me this flexibility to be able to work on the weekends, etc. when I need to. But I think you learn more from outside the classrooms than you learn in the classrooms if you're in this field, especially with community health. Maybe with biostatistics, it's not as easy to, but maybe you can still do research. But for me, that was something I was really grateful for.
Thanks, Kaula. And I love that you use beyond the syllabi. I think I want to use that when I'm speaking with my students as well, as we're talking about learning outside of the classroom. Thank you for that. Jen, what about you in terms of maybe extracurriculars or opportunities outside the classroom that you participated in your program?
Yeah, and I think I'll piggyback a little bit of Haula on the way that you said, you kind of learn more outside of the classroom. And I think that was definitely the case for me as well. I think what I learned in the class really informed what I took out. And for me, what led me to public health was a lot of community interaction. And so I have a very deep appreciation for community and the relationship with the community, either, directly where you live or, online as the world is right now. So a lot of opportunities that I had to kind of put public health into practice and kind of grow my own understanding of public health and my place in it was through different community outreach opportunities. And that was, through COVID, I did a lot of volunteering when it started and then went into the response for the state. I've had the opportunity to work with the American Red Cross, and that's connected me with a whole realm of different people as well. And it really kind of challenges what you know and gives back at the same time. So I would say my community relationship is definitely something that pushed me.
That's awesome. Thanks, Jen. And Dan, what about you?
Yeah, very similar to what Haula and Jen had said. Learning and taking your knowledge outside of the classroom has been extremely pivotal and a very influential experience for me. I've been very fortunate to hold 2 part-time positions, one of which was at the CDC during my time. And I also have been a teaching assistant for 2 separate classes while obtaining my degree, which has really allowed me to network with a lot of different people, faculty, and just really put a lot of the knowledge that I'm getting in the classroom into action to see it make a change, a real change in front of my eyes, which has been really impactful. And then kind of going in a different direction in terms of extracurriculars, being involved in clubs, and also just having social events at the school level has been really influential to meet people, because public health is so collaborative and so interdisciplinary. It's been really unique to see how everyone came to the field of public health. And it's also allowed me to connect with my classmates. And I've had classmates send me job opportunities. I've sent them job opportunities, things like that. So that's really been an experience that I'm very appreciative of.
Thanks, Dan. And I love, all of you and what you've kind of said in your responses in terms of working with your community like Jen, or working with your faculty and, engaging with even your peers at this level. I think the beauty of graduate and professional school is that you're in a networking environment like pretty much all the time. When you enter the field of public health, it's kind of like we're all in this together, right? These are going to be your colleagues for life, your faculty members, your community members that might already have that master's or their doctoral degrees. Even though they're at that faculty level and they're your instructors, they'll become your peers one day. And so it's really exciting. And I love to emphasize, that collaborative aspect, both inside and outside the classroom, as our ambassadors have experienced. And so with that said, thinking about the Masters of Public Health program and thinking about your previous experiences even before you entered the program, what do you think are some background? So for future applicants, for example, what type of background would you consider meaningful to become a good candidate for a Master of Public Health or a Master of Science of Public Health degree? So I'll go ahead and start with Larry, because I know, Larry, you have your master's degree, but you're also pursuing a doctoral program. So I think your perspective would be very interesting to for our participants today.
Sure. So I think there's a lot more capacity to educate MPH students now, I've seen exponential growth, or it feels like exponential growth in the number of seats that are available in different schools. And with multiple programs offering an online, either a fully online or online option or a hybrid version of an MPH program. So there's definitely a lot more capacity to train folks in public health than there have been in years past. But as far as how to be a good candidate, I think being able to tell your story and to identify how the MPH education is going to allow you to contribute to public health and advance your career goals. And so that's going to look different for different people depending on where you're starting, whether you took undergrad and whether you're going straight from undergrad into graduate schools, or have some work experience, or have a specific path in mind. If you're in medical school and pursuing an MD, MPH, every combination of experience and education will yield a different story. But really being able to tell your story and if needed, explain what's in your either in your transcript or in your resume, so that those who are making admissions decisions can be informed as to why you. And so I think those are the key things I would point to: understand why you want to pursue the MPH, and then being able to articulate how your background, how your trajectory will benefit from the MPH degree.
Thanks, Larry. And Nora, what about you?
Yeah, so I agree very much so with Larry. And so what I would add to is to say, figure out what really fuels you, what makes you angry or happy, what keeps you up at night. What are the things in the world that are going on that you find interesting? And I would say that sometimes people think that they need to know all the education, know all the knowledge about these topics, but there is a lot of power in humility. So when you're applying, say, like I'm really interested in maternal and child health, but I don't know a lot about it, which is why I want to attend, your School of Public Health and gain more knowledge, gain more insight, work with these faculties, and really strengthen my skills so that I can be a player in this field. Sometimes people are going to be like, I know what I'm doing. This is what I want. This is my passion. After undergrad, I did this, this, and this. So it is going to look very different. But in a generalized format, I would say find your passion, find what burns you, find what keeps you up at night, because from that, you can write a really good essay, you can know your story, and you can really convince a committee to let you in.
Awesome. Thanks, Nora and Larry. Does any other, just look at other panelists. I also want to open this question up to you all as well. As you were thinking about applying, what are some things about your background or things that you would consider meaningful to become a good candidate? Go ahead, Kaula.
Yes, I wrote this in the Q&A as well. For many people had this question too, and I think you should keep in mind that public health is a very, very welcoming field, and a lot of backgrounds would be so valuable because it's such a holistic field. So for me, I worked with people that had auditory sciences degrees before that. I would not have imagined that as an entryway to public health, but that was great because then they were thinking about auditory accessibility on campuses, and that's such an important topic, Or sociology. I took a class in cultural anthropology in undergrad, and I would have never thought to mention that, for example, in my application, but I ended up using what I learned a lot in health communication for COVID, or in my qualitative research courses. We had people with nutrition background that came in. So any type of background that you have is really valuable, because public health, it's really so linked to systems, and systems are so diverse. So it's really great to feel welcomed in the field, but also to reflect a lot of reflections. What are some specific courses you did that really left a mark? That you think you might choose skills from them, or what is an experience? What is a lived experience? Maybe even you had, like Noor said, what makes you angry? What makes you want to make a difference? And really reflect on those and bring your individual stories, because again, it's a very, very welcoming field.
Awesome. Thank you so much. And I love, the responses that all of our ambassadors have offered for this question. We talk about telling your story. We talk about, how it is such a welcoming field. I think, something that I tell students when you are considering applying to a school or program in public health is that public health is so multidisciplinary. I think the common misconception is that, you have to have a science background in order to enter into public health, but in reality, anyone can get involved. We invite you to come into public health, whether you're an English major, a film major, a theater major, like look at all the skills that you've learned in your undergrad. Those are things that you can bring in to contribute to what, as Nora said, the art of medicine, the art of public health. So know that, even though you might not think you have like the skills, like, oh, I'm like terrible at math. I was terrible at math when I entered public health school. But those are things that we invite you in and we invite you to learn and teach you as you consider a career in public health. So thinking about careers, right? What advice do our panelists have for securing a competitive job in the field of public health? So we could talk about internships of when you were in the program, but for our folks that have graduated, even looking for a full-time job in your current roles. So let's go ahead and start with Jen on this question.
Yeah, after graduating, I was asking myself the same question. It was tough for me through the process of getting my first job after graduating, just kind of knowing where to start with everything. But I would say, through my master's degree, I really looked, to get internships where I could connect with different professors and help them on different research projects, because coming in, I did have very limited public health experience, and I was quite nervous going into the job market, with a lack of experience. All experience is valuable. And so coming out of it, I really had to kind of talk to myself and say, be confident in what you learned in school, because, the classes are very interactive. It's not meant to just be this academic kind of set, class. It's meant to be very applicable. And so, gaining the confidence in what I learned and being empowered in that. And then also really leaning on the connections that I had made, sending them my resume to say, does this look right? Should I change it? Sending different cover letters to people who are applicable, and really just leaning on those people who I trusted most to help me get out there.
Awesome. Thank you so much, Jen. Kaola, what about you?
So I guess I will challenge the question a bit. Like, I don't know how we would define a competitive job, because if it depends what your priorities are. Because, for example, in my undergrad, I had some my friends that went into investment and business, and within like 2 weeks of graduating undergrad, they were making figures that are triple what I would ever make, for example. So it really depends. Are you looking for job security? Are you looking for impact, etc.? So it's okay. This is not embarrassing to think of. If you want, what do you want to get out of this? If it is a path that you want to just really make a lot of money, maybe do it by statistics or anything else. No, but kind of create your path towards what you really would like. If, as Jen said, you can do many baby steps throughout your program to get to know, let people know you, do some consultancies, do some research projects, etc. But also if you want to make an impact, there's many ways. You can either go big with big organizations, or you can go really grassroots, go work with NGOs in your community that might really, really benefit from your skills. So I think it's a tricky question. It's how you define what is competitive to you, but I think it's a field that has a lot of growth opportunity for yourself. So where you start may not be where you end. You might switch paths throughout. So really do a lot of reflection. Compare with your own self. Don't compare with your undergrad friends who studied business. But no, really, and yeah, build your connections, volunteer when you can, be present, really show up, whether that is show up to events, to webinars like you just did now. You never know who you might meet and connect with, or show up to events, community events, volunteering events, and really reflect personally, what is it that you want to get out of your career in public health, and how can you do small steps towards it?
Thank you. That's such great advice, Kaola. I really appreciate you sharing not like the nuances of the job search, such as like the job, like what do you really want out of it? I do think like having that time to reflect upon yourself is very important, because that's the benefit of also having public health be such a diverse field where you can get involved in pretty much anything, but it's also a little bit of a curse because you have to kind of like narrow it down, right? And kind of yourself like, really, what do I want out of this? And part of your public health journey in your program is helping figure that out. Dan, what about you in terms of advice in securing a job, whether in your program or after graduation?
Yeah, I definitely think networking all around is really important. I know it obviously always hurts everyone's ego just a little bit when you hear no, but that is the worst thing that happens is someone says no. So you can't be afraid to put yourself out there. And that's really important because you never know what opportunity is going to kind of fall in your lap. And then also I challenge you to take a variety of different experiences, but also really look and reflect on what are the transferable skills that you're acquiring from these experiences, and not necessarily what you did in the day-to-day job requirements, but how can those transfer and how can you serve to better a different organization or whatever it may be. And just know that it's not going to be a straight line. Your first job is not going to potentially be your forever job, and that's okay. And so you really just need to find yourself. Don't be too hard on yourself because it all eventually will work out.
Great. Thanks so much, Dan. And Larry, do you have anything to contribute for this question in terms of the job search?
Oh, I appreciate everything that my fellow panelists have said so far. I think that similar to the question about how do you become a good candidate for MPH programs, it's similar to how do you become a competitive applicant for professional opportunities. It's thinking about what you're passionate about, what's important to you, what gives you a sense of satisfaction and that you're contributing to society. I think in addition to what you're learning in the classroom, think about how do you complement that with real world experience. And if it's not through a practicum or through an internship, then perhaps identifying opportunities to be part of a volunteer initiative or volunteer your time and expertise, even if you're not being paid for it in the short term, it may contribute to opportunities down the road and is a way to expand your professional network as well. I'll just share real quickly one opportunity that I was able to participate in as a result of volunteering or just showing up was being part of a healthcare transformation initiative in Rhode Island, where as an MPH student, I showed up to these public open meetings and sat quietly in the back of the room and listened to Medicaid director and health insurance commissioner talk about pre-Obama, pre-Affordable Care Act. Kind of what's on the horizon for healthcare, for health insurance in the US. And a lot of the conversation was over my head at the time, but I was curious. And so I showed up and was present. And one day the health insurance commissioner for our state recognized me because he'd been a lecturer at my school. He came up to me after meetings and, not rudely, but kind of like, what are you doing here? And so I said, I was curious and I wanted to see what was going on. And so he's like, cool, definitely keep on coming. He encouraged me to stay involved. And a couple of years later, I ended up being the vice chair of this $20 million initiative in Rhode Island to transform our healthcare delivery system and insurance and stakeholder engagement. But it all went back to, had I not shown up, had I not been present, had I not been curious and been in the space, even though I wasn't being paid for it, I would have never had that opportunity to be exposed to the conversation and to expand my network. And so those are some of the types of things that I would encourage folks to keep in mind as you think about how do you get from the classroom to the boardroom, if you want to frame it that way.
That's awesome, Larry, and congratulations on all your really wonderful experiences. That's so wonderful. I want to keep an eye on time. So you all are This is Public Health ambassadors. You are not only ambassadors to your schools or programs, but to the entire field. And so when we think about This is Public Health, again, we kind of think about how to define it. And so I want to ask each of you, what is public health to you? Okay, I know that's a loaded question. Let's go ahead and start with Noor.
So I kind of mentioned this before, but to me, public health is the art of medicine. And what that means to me is learning how to empower and engage the communities that you are around or that you interact with. And, that can be from your siblings to your neighbor to, the elementary, middle school, and high schools that are near you. Public health is so much about, kind of what everybody has said in the last question, is showing up and recognizing that there are problems that need to be fixed, some systemic and some that happened, an hour ago. But public health to me is it's the art of medicine, but what that really means is showing up and showing out.
Awesome. Thanks, Noor. And Dan, what about you? What is public health to you?
Yeah, public health at its core is the intersectional and collaborative approach to better the community health and that it looks different in every community, like Noor said. But it takes listening, engaging with community stakeholders, and learning to really understand what bettering the community health means for that given locale.
Thanks, Dan. Jen, what's public health to you?
I echo both Dan and Noor of their definitions, and I think mine's going to sound a little broad, but to me, public health is kind of everything. I think it goes down to the choices that we make every day, to the systems that we interact with, to objects that we have just right in front of us. And so something that I really enjoy doing and playing is, how is this public health? How is this one thing that I do every day public health, and how is it related? And what I think that does, it's really kind of highlights how interconnected public health and nuanced it is within just everything that we do, and how important that is to highlight.
Awesome. Thank you. Gala, what about you?
Yes, so for me, I think public health is really like a revolution on its own. So it's an art of change making that it really looks at its core to have more equitable opportunities of health flourishing for all. So that could mean access to safety, security, healthcare as fundamental human rights and needs, but it can also mean that it's the field that challenges histories of oppression, sexism, xenophobia, classism, exploitation, and many other well-being individuals and their quality of life.
Thank you, Kaola. And Larry, what is public health to you?
I really don't have much of substance to add to what my peers have said. They've all said it pretty eloquently, but I can share a metaphor that Dr. Sandro Galea from the Boston University School of Public Health shared a couple of years ago. He described public health as a championship soccer team, and used the U.S. women's soccer team as the example, who had won a couple of years in a row. The goalie is the healthcare delivery system, and the position players are the public health workforce, who are proactively engaged in challenging systems of oppression and equipping our communities with access to the resources that are needed to be healthy, ensuring that we have quality education and that there are employment opportunities, that we have safe physical environments. And those are all of the things that the position players in public health are engaged in. And as we've heard, it's an intersectional effort, requires partnerships outside of traditional public health and engaging the not the usual suspects in this work. And so I think as we engage with each other and as students and as professionals and our peers and community, there's a lot of opportunity to advance public health through all of these issue areas.
I love it. Thank you all so much. And thanks so much to the ambassadors for their time and for their insight and experiences. I hope that this was really helpful for you. If you're a prospective student that's curious about the field of public health, I hope that this was helpful in answering some of the questions that you might have had. So with that said, thank you so much to our panelists. We'll go ahead and start wrapping up the event. I do want to tell you a little bit about some of the things that we have coming up. I do want to emphasize that this webinar is being recorded. It will be available on the webinar event page on the ASPPH website very soon. You will go ahead and if you have any questions, you may contact students at ASPPH.org. And then feel free to go ahead and register and join us next week. We do have an event, the Graduate School Fair, the This is Public Health Graduate School Fair, that's going to take place on January 19th, 2022. We talked about in our conversation the importance of networking, and this is your chance. So I encourage you all, go over and head to that link and register so that you can meet some of our faculty or staff members and even our TIPH ambassadors over at the Graduate School Fair. Okay, well, thank you so much. I appreciate all of your time today. If you have any questions at all, please feel free to reach out to us at ASPPH, and have a wonderful week ahead. Take care.